As we begin a new year, I want to speak to you about the ongoing battle with COVID-19 and the challenges posed by the Omicron variant. Throughout this pandemic, I made a promise to you to speak plainly about the virus and how Ontario is responding, to share with you what I know, what our experts have told us, and to never shy away from being upfront with the people of Ontario. As you know, like in other provinces and countries around the world, Omicron case counts are rising exponentially across the province. We face a tsunami of new cases in the days and weeks ahead. And as we do, virtually everyone in this province will know someone who has been exposed to this virus. Now, we're bracing for impact. Based on our real-world experience here in Ontario, the evidence tells us that about 1% of people who get Omicron will end up in the hospital. That may not seem a lot, and under past waves, it might have been something we could withstand, but Omicron isn't like the other variants. It's much, much more transmissible. So the math isn't on our side. Based on the current trends, our public health experts tell us we could see hundreds of thousands of cases every single day. 1% of hundreds of thousands is too many new patients for our hospitals to handle. Over the past few days, we've started to see an alarming number of new hospital admissions, now with triple-digit admissions into hospitals every single day. This is a problem that will only get worse as we confront the looming wave of Omicron. The reality is that people are coming into hospital and leaving soon after, sometimes only staying for a couple days. This is a very different problem than we faced in the past, when COVID hospitals stay were weeks long in intensive care units. But even so, with Omicron surging across Ontario at a current rate, Ontario Health modeling tells us we could be thousands of beds short in the coming weeks. We can't let that happen. This data is a clear call to further action. We must do everything in our powers to protect our hospitals and to ensure our frontline workers aren't overwhelmed. We've been adding new beds across the province for many months and will continue to do so. The investments we've made in our hospitals are larger than any previous government in the history of Ontario. But with a variant as infectious as Omicron, with spreads like nothing we've seen before, added capacity alone isn't enough. We need to implement measures that further reduce contacts and mobility. Effective Wednesday, January 5th at 12:01 a.m., Ontario will return to a modified Step 2 of the roadmap to reopen. The plan will be released before we confronted Omicron, laid out 2 clear reasons why we would implement province-wide measures. First, the introduction of a new variant. Second, if our healthcare system was threatened. Today, we face both of these. Our plan demands that we implement additional public health measures. Minister Elliott will share details with you shortly on what exactly this entails. But it will mean the closure of more indoor spaces where we know the risk of transmission is higher, especially with Omicron. But let me be clear, these will be targeted and they will be time limited. The immediate goal of these measures will be to blunt the latest wave so we can ease the pressure on our hospitals and allow more time to deliver these all-important booster shots, which continue at a tremendous pace. Because vaccines remain the key to our long-term success against this virus, and the call to arms we issued last month has been answered loud and clear. We have delivered over 24 million shots to Ontarians, including 3.7 million booster shots. And over 1,300 regulated healthcare professionals, both active and retired, have stepped up to support the vaccine effort. This includes firefighters, first responders, and health professionals. This display of selflessness and Ontario spirit has exceeded our expectations, and we are so grateful to each and every one of them, but we need to give our booster effort time it needs to succeed. And that means doing whatever possible to slow the spread of Omicron. And I say slow the spread because it can't be stopped. Look to other countries, other provinces. It's too contagious to stop completely. So we need to slow it down in order to deliver these shots and ensure our hospitals stay strong. That is what these measures will do, so there is no choice but to act quickly and get them in place for a limited period of time. But just because the way forward was clear, that doesn't mean these decisions are without cost. And I understand these costs are significant, and the hardship of these decisions are not shared equally. That's why we're introducing expanded supports for small businesses. And it's why I've asked Minister Bethlenfalvy to continue working on fast-tracking more supports for businesses that have already shouldered so much of this pandemic. And to all the parents, I'm going to tell you that these measures will have an effect on our schools as well. We need to prioritize the continued health and safety of our kids and our school staff. As a result, we'll be delaying the return to in-class learning for the next 2 weeks and continue with virtual learning for the duration of the time away. I know this isn't the news anyone wants to hear, but with the new variant, the ground is shifting every single day. The level of absenteeism we're seeing in other sectors tells us with absolute certainty that operating schools, ensuring teachers are on the job and not homesick, will be a challenge we cannot overcome in the short term. These 2 weeks will provide much needed time for more vaccines, more boosters. It's more time for additional public health measures to blunt the rapid rise in cases. I know online learning isn't ideal, but above all else, I want to provide students and parents with certainty, not the turmoil of school closures because not enough staff are available to teach our kids. Now these decisions will disappoint people, they will confuse some people, and they will anger some people. I understand all those reactions. As Premier, these are the hardest decisions I make, but we follow the data. And the fact is this: Omicron spreads like wildfire. It only takes the smallest opportunity to infect. And if we do not act, if we don't do everything possible to get this variant under control, the results could be catastrophic. It is a risk I cannot take. Not after what we've been through and what we've been able to accomplish together. We are now entering the 3rd calendar year of this pandemic. It has been the greatest challenge of our generation. We want this to be the year when we finally win the war against COVID and begin the road to recovery. To do that, we must show more determination, more resolve than ever before. It's never been easy, and it won't start now. But we can and we will get through this. I want to thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier. As the Premier mentioned, in Ontario, we have recently seen a rapid increase in COVID-19 hospitalizations. The latest evidence has demonstrated that while the Omicron variant is less severe, its high transmissibility has resulted in a larger number of short-term hospital admissions. Recently, we reported our highest number of cases ever, and this is expected to increase further in the coming days. This rapid rise of Omicron cases, combined with staff absenteeism due to Omicron infection and exposure, could result in the province's hospital capacity becoming overwhelmed if further action isn't taken to curb transmission. And as Dr. Moore has continued to say, as the evidence on Omicron continues to evolve, our pandemic response must evolve with it. That's why, effective Wednesday, January 5th, the province will return to a modified version of Step 2 of the Roadmap to Reopen. These time-limited measures will help blunt transmission and preserve our hospital bed capacity. Measures include reducing social gathering limits to 5 people indoors and 10 people outdoors, requiring businesses and organizations to ensure employees work remotely unless the nature of their work requires them to be on site, closing indoor dining at restaurants, bars, and other food or drink establishments while permitting outdoor dining with restrictions, takeout, drive-through, and delivery, closing select indoor settings, including theaters, cinemas, and museums, but permitting outdoor establishments to open with restrictions, closing indoor sport and recreational facilities, including gyms, and permitting outdoor sport facilities to operate with certain requirements. Retail settings, including shopping malls, will operate at 50% capacity, along with personal care services. And indoor weddings, funerals, and religious services will be limited to 50% capacity, with outdoor services limited to the number of people that can maintain 2 meters of physical distance. In addition, on January 5th, the province will reinstate Directive 2 for hospitals and regulated health professionals, instructing hospitals to pause all non-emergent and non-urgent surgeries and procedures in order to preserve critical care and human resource capacity in the healthcare system. These measures will be in place for at least 21 days, until January 26, 2022, subject to trends and key indicators, and of course in consultation with Ontario's Chief Medical Officer of Health. I want everyone to know this was not an easy decision. This is not the situation any of us wanted to be in. I know everyone is tired, especially after what was a tough holiday season. But based on the data, emerging evidence on Omicron, and what our hospital partners are experiencing on the ground, these additional time-limited measures are needed to preserve our hospital capacity as we accelerate our booster dose rollout. We are vaccinating hundreds of thousands of people every day, and I strongly urge everyone to please get your first, second, or booster dose as soon as you can. By implementing these time-limited measures, we will get through this critical period in January and continue our work to end this pandemic once and for all. Thank you.
Okay, we'll take questions from the floor before we move to the phones. Just a reminder, it's one question and one follow-up.
Hello, Premier and the rest. You've given us some basic sort of back-of-the-napkin math about what 50,000 cases in a day would do to the hospital system, but the government's no longer tracking cases with the same rigor that it was before. And people have been told to simply assume that they have COVID if they show symptoms. So what are the metrics being used, and when must they be met by for all these measures, things like non-urgent surgeries to resume, schools to reopen, gyms to reopen, to happen? Because there's no timeline that you've given here.
Yeah, I think this would be best answered by Dr. Moore.
Thank you, Premier. The most important metric that we're monitoring is the hospitalization rate. We know Omicron is going to have a significant burden on admissions to hospitals so that we can provide the right care to the right people at the right time. Those individuals primarily require oxygen. We've been following the data very closely, and the vast majority won't require ICU or mechanical ventilation, which is good news for us, but we'll still maintain, obviously, that capacity and that service if and when needed. So Ontarians and all key decision makers should be monitoring the hospitalization rates. That will ascend fairly rapidly over the coming weeks. We anticipate that it'll reach its maximum by the end of January and then start to descend. So we anticipate a very short, quick, and rapid approach to this epidemic and impact on the healthcare system. That is why these measures are timely. They're proportionate to the risk. They should diminish the burden on the healthcare system. They should buy us time to be able able to increase their doses to prevent hospitalization. They'll also buy us time for the arrival of antivirals, which could decrease the burden on hospitalization, to be able to decrease that burden by providing outpatient oral therapies for individuals. These are sacrifices that we'll all have to make. But if we're looking particularly at the metric, which was your key question, it's all about monitoring the impact on the healthcare system. Because this is so transmissible, passing so rapidly through our communities, that is the burden that we're trying to prevent.
So with that being said, and you saying that I believe this increase in cases will reach its peak by the end of January, but schools are only closed for the next 2 weeks. So should we instead assume that schools will actually be closed until the end of January, at which point we'll have a better idea of what sort of impact this has had? Because people want certainty. We're 2 years into this. Premier, you just said that people want certainty. What sort of certainty can we give about a timeline here, or really is the best answer that there is no certainty at this point?
For certainty, we've projected this impact on the healthcare system through modeling, through actively monitoring the current cases that we have and their acceleration on hospitalization. So that prediction may be diminished by these public health measures, by increasing provision of immunization in the community. Certainly, the time that we have now from the 5th to the 17th for schools gives us extra time to be able to provide access for students, for workers in that environment, to best protect them, to have a safe opening. And we're constantly reviewing best practices in the school setting to keep them as safe as we can. But all of this has been data-driven, and absolutely this government has shown that it will follow the data and monitor the risk. The intervention of public health measures is deemed to be short-term, to blunt the impact on the healthcare system, and is different than what we put in place at other times in this pandemic, where we've tried to totally decrease the case count and get us through the whole 3 or 4 months of the threat of the various variants that have circulated in Ontario. That is not the purpose of these public health measures. We're not going to be able to stop it. We'll have to blunt it as best we can through the sacrifices of Ontarians, and at the same time maintaining all essential services.
Okay, and we're ready to move to the phones.
Chris Rashewi, Toronto Star.
Hi, Chris.
Oh, hi. Thanks for taking my questions. Just a few days ago, your government and Dr. Moore announced that schools would open on January 5th, that it was safe to do so, and that children had already sacrificed enough in this pandemic. So what exactly has changed since then to make you change your mind?
Well, there's 3 major factors, and it's case counts right off the hop, and hospitalization. I'll just put that into perspective for people. The report, I was told that we could see hundreds of thousands of cases. Let's be conservative. Let's say 100,000 cases or 200,000. That's a day. That's 1,000 people, 2,000 people showing up to hospitals. That's not sustainable. So we have to look at the case counts for hospitalizations, and then we have to protect our hospitals. But another big factor, and I spent all weekend speaking obviously to the health professionals, Dr. Moore and Matt Anderson, that's joined us today, CEO of Ontario Health. I've spoken to the labor leaders. I've spoken to numerous CEOs of large corporations. One CEO told me, a large courier company, told me that they saw 300 people in a single day not show up to work. We want to make sure that we protect the frontline healthcare workers. We want to make sure we protect the students and the teachers along with the general public. This took me about 30 seconds to make a decision. It was a decisive decision, and we're going to make sure that we go through this and be as cautious as possible and use every tool in our toolbox to sustain not only our health care, but our economy as well.
Follow-up?
Thank you. Yes, and I'm just wondering, how can parents plan ahead and trust you when you say that schools will reopen? Because in the past, you've kept extending virtual schooling more so than any other province.
Well, again, the number one priority is to make sure that the kids have an opportunity to learn online. That's absolutely critical. But we have to protect the overall system. When I talk about the system, I'm talking again the hospitalizations, the schools, the economy, the businesses. That's who we have to protect. And we've never seen anything like this. And let's keep in mind, this isn't just Ontario-based. Everyone watches the news. You see what's happening across the world. You see what's happening across our country and our U.S. neighbors. We're going to make sure that we throw everything we have. We will not spare a penny to make sure we can get through this surge of Omicron cases.
Next question.
Adrian Gabriel, CDTV.
Andrew?
Hi, Premier. When it comes to the school closures, let's say they are closed just for the next 2 weeks, is there anything that your government can tell parents that they're going to actively do in the next 2 weeks to fortify our schools, to give them a fighting chance of reopening? Are we looking at a rapid testing program? Anything at all that you guys are doing above and beyond what is already being done when it comes to safety in schools?
Yeah, well, first of all, I want to give a shout out to Minister Lecce. I always say he's the best Minister of Education in the country. He has done everything in his power to make sure that schools can move forward throughout this whole pandemic. He's made sure that we have N95 masks for educators, which is unheard of, by the way. There's no jurisdiction in Canada that has N95 masks. We're going to make sure that the cleaning enhances the cleaning. We're making sure that we have the rapid test. He sent out 11 million tests right across this province. He's doing an incredible job. We're going to continue focusing on making sure that not just schools, but everywhere right across the province can move forward. This may be a bump in the road, and a pretty big bump. As I said, we're going to get hit like a tsunami. I also said brace for impact, because some people don't understand the volume that's going to hit us. And again, if we have 1,000 or 2,000 people showing up to hospitals across this province, it's going to be very, very challenging. And to speak about the hospitals and the challenges they're facing, I would like to bring up Matt Anderson. Matt has been an absolute champion right from the beginning of this pandemic, no matter if it came to testing or keeping our hospitals safe and up and going. And I just want to tell you, you may not see him on TV a lot, but he's just a real machine behind the scenes that are driving the hospitals and moving them forward. So Matt, if you could come up for a minute.
Thank you, Premier. Thank you for the opportunity to come and speak today, and thank you, everyone, and good morning. Just a few things I think that I would highlight from what's been discussed already. Our big challenge, as you've already heard, is the really big increase in cases, and this is different. We've talked about this. You heard Dr. Moore mention it before. This is a different wave for us. These are cases that are coming into our wards, meaning our main areas within the hospital. We're seeing those cases climb very dramatically. We're seeing this in other parts of the world as well. We have to be ready to try to bring that curve down, and every day matters for us. What you're hearing today are plans and things that are hopefully going to blunt that curve, to use the words of Dr. Moore. Extraordinarily important that we try to blunt that curve to push off when does this peak happen inside our hospitals. If we can push this off far enough, allowing vaccine to work, allowing us to get antivirals into our environment, we can get to a place where we do not have this overwhelming our healthcare system. And I would just make the additional comment as well. We talk about the hospital system, but it is the whole healthcare system. This is about home care. This is about long-term care. It's about primary care. All of the system has to be on its feet, working together to make sure that we are supporting our citizens in the places where they need care the most. When we think about that, certainly our Directive 2, which is to limit procedures and surgeries within our hospitals to keep them at urgent and emergent only. That is a hospital initiative, but the public health measures that we're talking about here go beyond that. You've also heard a lot about health human resources. We are very challenged in health human resources in all sectors. Our public health measures are intended to help in all sectors as we make sure that our home care, our long-term care, our primary care all stay online and are able to assist in this effort to make sure that we are here to support all of you as we go through this challenging time together. So it's really bringing all of those pieces together. Anything that we can do together to keep pushing back that wave buys us more time, helps our hospitals, but helps all of our healthcare system in our response to COVID. Thank you.
Follow-up?
Thanks for that. Without any doubt, I don't think anyone's questioning just how hard people are working. However, my question was about what's being done over at least the next 2 weeks to reinforce the safety measures in our schools. That question wasn't answered. So I'll ask this question instead. We've previously heard, parents across the province have previously heard that schools should be the last to close and the first to reopen. In today's announcement, retail is still allowed to remain open at 50% capacity. Is anyone able to promise families across this province that schools will be reopened before any other business sector is reopened?
Well, what I can tell you when it comes to the schools, and I did mention a lot of things already, but we have to make sure that right across the province, when it comes to absenteeism, and this doesn't just affect the schools, the teachers and other areas, no matter if it's healthcare or businesses, the economy, we have to make sure we have people in the classroom. Make sure we have teachers in the classroom. We have to make sure we have people in the factories and in offices to make sure we keep the economy going. We have to make sure we protect our healthcare workers to make sure that they'll be able to go into the hospitals and support people coming in. So it's not just about making sure that the schools are safe. I think it goes hand in hand right across the board. When there's community spread at this rate, that we've seen that vertical spike on the cases like we've never seen before. Again, when you have 100, 200, 300,000 people getting sick, and 1,000, 2,000, 3,000 people are showing up to the hospitals, that's my number one concern, to make sure that we maintain a strong healthcare system. And with the people behind me, I have 100% confidence that's going to happen.
Next question.
Holly Mackenzie-Suter, Canadian Press.
Hi, I want to ask about the directive on hospitals and the surgeries. This is something that yourself and health system officials have said wouldn't happen again during the pandemic, and now it is. And it's not really clear to me from this announcement why now is the right time to be pausing these non-urgent surgeries. And I'm wondering if you could expand a little bit on what are the factors behind that decision? Is it a staffing issue, or are we unable to care for all the people in ICU right now? I'm just wondering if you could elaborate on what has made this the moment to actually pause the surgeries that, as you know, the backlog's gotten higher and people, they could be life-changing for a lot of people.
Well, I'll pass this over to Minister Elliott and then over to Dr. Moore. Thank you.
Well, you're right. Many people have been waiting to have surgeries and procedures done for a long period of time, and we have been working on that in the last few months. But with the Omicron variant spiking in the way that it is, and with the numbers of hospitalizations increasing rapidly, we will unfortunately need the bed spaces as well as the staff in order to be able to treat people with Omicron and whatever else comes into the hospital that they needed to be treated for. So we are facing absenteeism of many healthcare workers because they also have Omicron, and we are trying to build up those reserves. We have introduced about 1,300 new people in the last few months to work in our hospitals, but we need both the spaces as well as the people in order to care for the people with Omicron. But perhaps Dr. Moore could add more to that specifically.
Yeah, thank you, Minister. At any given time in the coming weeks, we can expect across all sectors a 20 to 30% absenteeism as a result of Omicron spreading so rapidly across Ontario. So our health system has to start building continuity of operations plans. They have to anticipate that we won't have as many staff as necessary. And also, we have to also prepare increased bed capacity. So putting in Directive Number 2 gives us, and we've consulted clearly with Matt Anderson, who's here, 1,200 to 1,500 additional beds that can provide care to patients with Omicron in the health system. We anticipate through the modeling that those 1,200 to 1,500 beds will be essential to be able to provide oxygen and care. And as the Minister has already said, we're trying to get as many healthcare workers back in a shorter time period, but tested with our ATs to ensure that there's no risk of transmission in the workplace. So all of those plans to ensure Ontarians get the right care at the right time, at the right place, are in play, and we're absolutely doing this in consultation with all health system partners as we anticipate the rapid increase heading into the second, third, and fourth weeks of January.
Follow-up, and this will be the last question.
Yeah, do you guys have any numbers on how many procedures are actually going to be affected by this, in the 21-day window, and any idea of how long the wait list is right now as well?
Matt Anderson.
Thank you for the question. First, just to say, it's a very poignant question. As you've heard throughout the discussion today, these decisions are not taken lightly, and there is consequence to them, and we're very aware of that. In the case of, specifically to your question, generally what we would look at through a typical week would be somewhere between 8,000 to 10,000 surgeries or other procedures that will be impacted by this. So that would be what would add to our wait list. I don't have a specific wait list date for you. If you follow up, we can get you, because we track it by procedure, so we would have to give you that information by procedure. But overall, those are the numbers that we're facing. And just to say, again, we recognize that although we are facing and doing our emergent surgeries and our urgent procedures, there is a cost here. We're absolutely sensitive to that, and as you've heard everyone speaking today, we want to get out of this as fast as possible, get our hospitals back up safely, and a key part of that is addressing the HHR challenges that we have throughout the system and giving more support to those fantastic people who are out there doing what they need to do every day. It comes with it was a tough decision, a big cost, but something that is necessary given what we're seeing in the numbers. Thank you.
Was that the last question?
Yeah.
Well, folks, I just want to speak to the people across the province. I know this is very, very challenging for each and every one of us across every single sector. What I can do is tell you that I can assure you we will get through this. We'll come out of this this battle that we're facing with Omicron. We'll come out stronger than ever before, and we'll get back to life as normal as quickly as possible. I want to thank each and every one of you. I want to thank the frontline healthcare workers and everyone else involved across the province, the people that are putting the shots into arms, and there's just tens of thousands of people helping out. It's truly Team Ontario. It's the Ontario spirit, and we'll together get through this. So thank you, and God bless each and every one of you.